I am Arian June. I am a partner at Debevoise and Plimpton here in Washington and also a board member of the National Health Law Program, or otherwise known as NHeLP. And today I'm here with Elizabeth Taylor.
And I'm very happy to be here, Arian. I'm Elizabeth Taylor. I'm the Executive Director of the National Health Law Program.
It's April and it's Medicaid Awareness Month, and we can't talk about NHeLP without talking about Medicaid. Tell me, Elizabeth, 55 years later, why is NHeLP's work for Medicaid still so critical?
The work is critical because Medicaid is critical. Medicaid saves lives. 90 million people in this country are getting their health care through the Medicaid program. That's 1 in 5 individuals in this country. 40% of all births in the country are paid for through the Medicaid program. 1/2 of the children in the country are getting their health insurance through the Medicaid program. And over 40% of people with disabilities are getting their health care through the Medicaid program.
Can you talk to me a little bit, Elizabeth, about all the ways that NHeLP is strengthening and working to expand Medicaid?
So, Medicaid saves lives, but it only saves lives if it is protected and enforced and defended. And so some of our advocacy is to strengthen the Medicaid program. For instance, we've worked with Congress and with the administration to improve the home and community-based services that are available to people with disabilities, to make sure that they can still live at home and in their communities and not in institutions. We've done a lot of work on behalf of children with specialized health needs. Medically complex children are children who need a lot of services. They need support from people, and they may need technological support in order to function, in order to live. And often, if they have those services and that technological support, they can live at home with their families.
And they can thrive.
And they can thrive with their families, which is where the families want them to be. If they don't have those services, then often they spend weeks, months in hospitals or other institutions, which is heartbreaking. So we have partnered with advocates in multiple states where the states weren't providing those services. We've brought enforcement actions, and we win because the children are entitled to those health care services. One mother said, you shouldn't need a lawyer to get health care for your children, but you do. And, we're very proud to be the lawyer.
To be those lawyers.
To be those lawyers.
Absolutely.
Another aspect of our work is that we work to ensure the full range of sexual and reproductive health services. And that includes the services that people need to bring a healthy child into the world, or the services that people need to make a choice with dignity that this is not the time to bring a child into the world. We're very proud of our Doula Medicaid project. We know that having a doula, a support person there, before, during, and after childbirth actually makes a difference in the outcome for the infant and for the mother. And so we've been working with doulas themselves, on the ground to find out what they need, how they work. And then we advocate in legislatures to make sure that Medicaid is covering the doula services. And an increasing number of states are including doula services in their Medicaid coverage, which is really exciting. So another aspect of it is that now that COVID, the official emergency is over, we're in what we call the COVID unwinding. So during COVID, any states that accepted additional federal funding had to keep everybody on their Medicaid rolls during the emergency. Now that the official emergency has ended, all of those states are redetermining eligibility for millions of people.
And are you seeing people lose their coverage under Medicaid?
Millions of people are being dropped off of the rolls. The states are overwhelmed. So now we're working with state advocates in multiple states to bring enforcement actions, because people have due process rights not to be dropped off the Medicaid rolls when they're entitled to be on the rolls.
It's just outstanding, the work that NHeLP has been doing. As we look to April and we are looking to celebrate Medicaid Awareness Month, any closing thoughts, Elizabeth, on what you want people to know about Medicaid and all of the need that's out there and all of the work that NHeLP is doing?
Join us in our vision that every person in this country has a right to the health care that they need to thrive. And join us in our work.
Join us indeed. And happy Medicaid Awareness Month.
And happy Medicaid Awareness Month. Thank you.
Thank you.